What is major depressive disorder, MDD? Major depressive disorder is a serious mental disorder that causes disability, and its treatment cost is high. Major depressive disorder can lead to a host of negative outcomes, including loss of jobs, relationships, and healthcare. There is no known cure for major depressive disorder, but treatment options are available that can help improve patient symptoms. What are the causes of MDD? The causes of MDD are still unknown, but there are a few suspected factors. Some research suggests that genes may play a role in developing MDD, while other studies suggest that environmental factors may also be involved. However, the exact cause of MDD remains unknown. 1. Genetic factors. Studies have found that MDD is linked to a variety of genetic factors, including variants in the serotonin transporter gene, SERT, which may lead to increased levels of the neurotransmitter serotonin in the brain. Other genetic factors that have been linked to MDD include variations in the monoamine oxidase gene, which can influence how well the body processes serotonin, and variations in chromosome 7q21, which has been associated with an increased risk for developing bipolar disorder. 2. Environmental factors. There are several environmental factors that may play a role. These include life stressors such as financial problems, family conflict, bereavement, or personal disasters, traumas such as abuse or neglect, and lifestyle factors such as smoking cigarettes or consuming excessive amounts of caffeine. 3. Hormones. Pregnancy and postpartum can both increase levels of estrogen and progesterone, two hormones that have been linked to an increased risk for MDD. 4. Other possible causes include genetic predisposition, stress, and exposure to environmental toxins. What are the risk factors of MDD? Researchers have identified several factors that are likely to increase your chances of developing MDD. Here are some of the most common risk factors. 1. History of depression or anxiety disorders. 2. Personal history of suicide attempts or thoughts. 3. Family history of major depression or bipolar disorder. 4. Environmental stressors such as financial difficulty, relationship problems, and traumatic events. 5. Genetics. Some people are more likely to develop MDD based on their genes and cannot avoid it no matter what they do. 6. Poor physical health. Being in poor physical condition can make you more prone to experiencing emotional problems, including depression. What are the symptoms of MDD? MDD is characterized by a persistent feeling of sadness and loss of interest or pleasure in activities that were once enjoyed, along with other symptoms such as poor sleep, weight gain, difficulty concentrating, and feelings of worthlessness. What are the types of MDD? Major depressive disorder, MDD, is a severe mood disorder that affects more than 20% of the population at some point in their lives. There are three main types of MDD: unipolar, bipolar, and cyclothymic. Unipolar MDD is just one type of MDD, and it's the most common. Bipolar disorder is when a person has two or more episodes of mania or depression within a 12-month period. Cyclothymic disorder is when a person has mild to moderate episodes of depression but doesn't have full-blown manic episodes. There are other types of classification. 1. MDD with anxious distress. About 50% of people with MDD experience significant symptoms of anxious distress, which can significantly impact their quality of life. Anxiety is a normal response to stress, but when anxiety becomes excessive or chronic, it can interfere with daily functioning. 2. MDD with mixed features. Mixed features are a common feature of MDD. They occur when symptoms of both mania and depression are present at the same time. They can make it difficult to tell whether someone has had an episode of bipolar MDD or unipolar MDD, and they can make it hard to get treatment for either type of MDD. 3. MDD with melancholic features. Some people with MDD experience features that are classified as melancholic, such as loss of interest in activities, decreased energy, increased appetite, weight gain, sleep problems, and feelings of hopelessness. People with melancholic MDD may also have difficulty concentrating and making decisions. 4. NDD with atypical features. About 5% to 10% of people with NDD have atypical features that may suggest a different diagnosis. Atypical features may include difficulty focusing attention or concentrating, irritability or excessive anger, sleep difficulties, decreased appetite or weight loss, rumination, such as thinking about and dwelling on negative thoughts, and excessive thoughts about death or suicide. 5. NDD with psychotic features. In some cases, individuals also experience psychotic features such as hallucinations and delusions. While the prevalence of NDD is estimated to be around 10%, the incidence of psychotic features is much higher, accounting for around 30% of all cases of NDD. There are several reasons why psychotic features might occur in patients with NDD. One theory suggests that the symptoms of NDD might lead to a disturbing cognitive process that results in the development of psychosis. Other possible explanations include changes in brain chemistry or abnormalities in neurotransmission. Regardless of the cause, it is important that clinicians consider any signs or symptoms of psychosis when diagnosing and treating patients with NDD. 6. NDD with catatonia. Some people with NDD develop a condition called catatonia. Catatonia is a condition that causes people to become paralyzed or extremely shy. Catatonia is a rare condition, but it's one that's often associated with major depression. 7. NDD with peripartum onset. Peripartum onset is a particularly serious form of the condition. It occurs when major depression first becomes evident during or shortly after childbirth. This is a rare condition, accounting for only about 1% of all cases of NDD. Unfortunately, peripartum onset NDD frequently leads to severe depression and even suicide. 8. NDD with seasonal pattern. There is a significant minority of people who experience NDD with a seasonal pattern, meaning that their symptoms tend to worsen during certain periods of the year. Such NDD includes seasonal affective disorder, SAD. How is NDD diagnosed? NDD can be diagnosed with a combination of symptoms and signs assessed by a doctor during a physical exam and comprehensive lab tests. Psychiatric evaluation is also often necessary to rule out other possible causes for the person's symptoms, such as substance abuse or an underlying medical condition. How is NDD treated? NDD is a mental illness that causes significant distress in the individual. The most common form of treatment for NDD is medication. There are many different types of medication that can be used to treat NDD. Some of the most common medications include antidepressants, antipsychotics, and mood stabilizers. Additionally, there are several types of psychotherapy that have been shown to be effective. One type of psychotherapy, known as cognitive behavioral therapy, CBT, is a structured approach that helps people learn how to change their thoughts and behaviors related to their depression. CBT typically includes weekly sessions in which patients are taught about the role that thoughts and feelings play in their depression, ways to identify and challenge negative thinking patterns, and strategies for managing stress. In conclusion, major depressive disorder is a serious mental illness that should not be taken lightly. It can cause a person to feel hopeless and helpless and can lead to suicide. If you or someone you know is suffering from major depressive disorder, please seek help from a doctor or mental health professional. There is no shame in seeking help, and there is no one who is too far gone to recover. If you enjoyed the video, please like, subscribe and share for more videos like this.